Yes, viewers, good evening. My name is Stella Doris. I'm a nursing officer working in Mulago National Referral Hospital, the in charge of 2C Pediatric Surgical Ward. Thank you so much. I just want to talk a few things in regards to the situation we are in this era of COVID in Mulago National Referral Hospital. As a member of Uganda Nurses and Midwives Union Mulago branch, we really appreciate the government of Uganda, His Excellency, the President of Uganda, Yoweri Kaguta Museveni, for all that he's doing to see that COVID is brought into control. I also want to thank the Ministry of Health and the team under the Minister of Health, Dr. Ruth Acheng, and Dr. Diana Atwine, for all the efforts that you are really making to see that this killer disease is really put into control. We really appreciate so much. I also want to appreciate my fellow nurses and midwives who have continuously and effortlessly continued to really provide their services amid this challenging time. However, I really want to encourage the nurses and midwives all over the country in this situation that we are in. COVID is a new disease, but COVID should not make us fail to practice our work as nurses and midwives in this country. I really want to appreciate all the nurses. I want to appreciate all the midwives and the entire health workers in this era of COVID, that besides COVID, other conditions like hypertension, diabetes, malaria, and other conditions are still coming hand in hand with COVID. When patients come, however much we are giving that health talk about COVID, let us also remember to give health talk on other conditions that is also taking the lives of our innocent people quietly. Thank you very much. I know we are working amid these challenges, but some of these challenges, it is all over the whole world, especially challenges of personal protective equipment. And it is our cry as nurses, as midwives, as health workers to the government to ensure that they avail us with personal protective equipment to all hospitals to ensure that our work goes on smoothly. We also appeal to the government of Uganda to really help and ensure that the scope of practice for nurses and midwives is expedited as quickly as possible. The Nurses Act of Nurses also has to really be expedited as quickly as possible, because the world all around us is looking at our country, Uganda, and they are asking, what has Uganda done to really contain the disease? Because if you are to look at Uganda, we are really working so hard, and it's because of the good health workers that we are having in this country. That's why this disease is really being contained, and we thank the government of Uganda so much for that, and we really thank the Ministry of Health and all the multi-sectoral institutions that have helped us to contain this disease. Above that, we also want to say health workers, including the nurses and midwives, need to work with a motivational kind of spirit. In most cases, we have been crying out loud to our president, to the government of Uganda in regards to the remuneration in terms of salary. And I think this is the right time. I want to bring this forward as a member of the union so that the government looks into it and considers health workers salaries. It should not only be per se that health workers, we are going to increase your salary, but the issue is, will the salary be increased to meet the basic needs of all the health workers in this country, just like other countries outside? I know it may not be very possible within a shortest period of time, but with the time, it should always be addressed so that we contain the health workers into our country. Uganda has to be a country which will shine. Uganda has to be a country which will bring other people from out to know how educated, how knowledgeable, how we do our practice, how committed we are in providing our health care. In issues of recruitment, we are still not yet very okay there, because right now that we are facing this challenge of COVID, many health workers are working long hours, not because they want it, but because they do not want to see fellow Ugandans suffer. So it is our cry to the government to see really that they recruit more nurses, more midwives, more health workers into the health system, because when we have good health, the rest comes in. But if our health is really deteriorating, people are not healthy in our communities, then it will not really be good. This is the time that we really have to carry our flag high as Ugandans and make sure we improve from the way we have been in the past. I really appreciate the health workers who have been on the front line for all the skills, the knowledge, the competences that they have shown the whole world in managing this deadly disease, COVID. I want to tell them that they have to keep up with the spirit. Then for my fellow nurses and midwives, COVID has just come and it will come to end. But other conditions, as we said, will still be with us. We have chronic diseases like those hypertension and diabetes. Let us make sure we handle all patients that come to the hospital according to the mandate of our health sector from the Ministry of Health. Let us serve them with a smile, let us serve them diligently, and let us serve them holistically. And I really appreciate the government, because right now the government has come to realize how effective the health workers of this country are. And it's my prayers that we should not be attempted to be taken up to get out of this country, because we together we can make our country better, just like other people are already admiring us. For the issue of personal protective equipment, it is our cry that the government avails us, because I know it is a challenge, but all hospitals should be having PPEs. We need a healthy health worker to provide a healthy environment also for the patients, because COVID has not only come for patients, it is for every one of us. Anybody can get it. We also appeal to the government when they are holding important decisions that regards to health. They shouldn't only look at other sectors. Also, the nurses need to be brought on board. Nurses and midwives are 80% of the work health force in the country, and they are the ones with the patients 24/7. That is 24 hours in a day, 7 days in a week. And nurses have evolved. Nurses have degrees, nurses have masters, nurses have PhDs, and they have very good input that they can put into decision making into this country. So it is our humble appeal to the government that we have nurse leaders everywhere, almost in every hospital in this country. You get a nurse who is informed, who is educated, and You talk to the nurse, she will tell you what you not want to, or what you did not expect to really hear. So let us bring all the nurses and the midwives and the health workers on board to ensure that the health of our country remains 100% perfect. To the community outside there, we really want to thank you so much, because you have really followed the presidential directive, and we shall be there always to serve you, because without you, our clients, without you, our brothers and sisters in the community, health would not stand, because health workers do not work on trees, we do not work on grass, we do not work on buildings, we do not work on any other thing. We work on human beings. So when they say wash your hands, keep social distance, wear a mask most of the time, avoid touching the eyes, avoid touching the nose, avoid touching the mouth. In case
Nelson Robert, I'm a nurse. I've been caring for COVID patients in Mulagwa National Referral Hospital. It's been a very good experience to care for COVID patients. At the beginning, it was a difficult experience because it's a new disease, and it was I feared it, but with the courage that I had, I managed to care for those patients. Caring for a new disease comes with a lot of courage. You're putting on a full coverall, and this coverall you are covered from head to toe. But you are sweating a lot, but you have to give a service. And it's been good to give a service to people with such a case. You have to give nursing care to all these patients. You have to give them drugs. You have to make their beds. You have to feed them. You have to make them comfortable, give them a comfortable environment for them to stay. This is a ward where they enter and they do not allow in relatives and friends to come and visit them. So you have to encourage these patients, give them psychosocial support, give them comfort, such that they are able to recover from that condition. And very many our patients recovered from COVID because we gave them the best.
Okay, what is your typical day like from the time you wake up to the time you go back to bed?
The typical day like is because it's a difficult day. You have to go in the morning, you receive a report, and when you receive a report, you have to prepare the team that will have to go in. You have to make a ward round, be part of the ward round to see the patients, how they slept. You have to give them medicine. You have to make their beds. You have to talk to them. You have to give them food. You give them breakfast. You give them lunch. And at the end of the day, you have to hand over to another shift. That's how a typical day was like.
You have a specific time lag in between, it says from 7 to 8 I do this, from this time to this I do this.
Yes, we have that specific time. Like from 8 up to 9 we receive a night report. Then from 9 from 9 up to between 9 and 11, you go in for, you take their breakfast, you go in for a medical round, take off their investigations, because there are different teams that go in, and afterwards then you come out.
Can you take us through the hardships you face while handling these COVID patients? What has been your greatest challenge in handling COVID patients?
Of course, one of the greatest challenges is language. Sometimes you find someone who can't speak English, can't speak Uganda or any other language, you don't know Swahili, and probably you don't know Swahili. So it becomes difficult to share with the patient.
What about in terms of commodities? In the gloves and what to use as nurses?
As nurses, we've been having those things to use, the medical supplies. We've been having gloves, we've been having personal protective equipment. They've been available.
As we mark International Nurses Day, what would be your message to the government?
The message to the government is that the government should look at the pay of scientists who include the nurses, the doctors. They should look at providing personal protective equipment to all the health workers at the front line. Front line here, I mean even health workers who are managing non-COVID patients. They need personal protective equipment. Because those personal, you do not know whether this is a COVID patient or whether it's not whether it's a COVID patient. COVID patients come from non-COVID patients. So these health workers need personal protective equipment. Government should try as much as possible to provide personal protective equipment to the frontline health workers.
Anything else besides salary? I know you guys have been struggling with salary.
Of course, housing is a problem. Many nurses and doctors are not housed in the hospital quarters. So very many were commuting from their homes. So there has also been a challenge of transport. As of lockdown, very many people didn't have means of how to get access to their health unit. So it's been a challenge as far as transport is concerned.
That's all.
So we need government should address the transport issues to the health workers. Leave alone the COVID issue. We should not talk about transport, because transport is an essential service and people need to come and work. So government should try as much as possible to provide transport to the health workers. There's been a lot of solidarity among health workers. We've been working as a team. We've been working as a team. As a team of doctors, nurses, laboratory staff, psychosocial team, the cleaning services, the security. So there has been a team that has managed the COVID. And indeed, we feel we've done a great job. And I still encourage health workers not to fear COVID. When you are well dressed, you are able to give a service to these Ugandans and even outsiders, or non-Ugandans, because this COVID case has affected everyone. So we should leave the issue of stigma. People should not fear people who are caring for COVID. Community should know COVID can get to anybody. And therefore, I would wish to tell community that they should receive the patients who are healed of COVID and receive them well in the community, because you don't know who is going to get COVID. how do you wish to be handled in the community when you discharged from a hospital? I feel everyone should be handled the way you feel you should be handled by the community.
We have cases there.
Yes, we still have cases.
How many people?
We still have 2 cases in Malawi.
Your name was again?
Bonimpa Nelson, Robert.
My name is Anyango Stella. I am a nurse by profession. I'm proud to be a nurse. I love nursing. I love the profession. And I do my work with a lot of passion because I have a lot of passion for nursing. And my joy comes when I give my services to a sick person and they get well. That is my biggest joy. When I see a patient come to the hospital and walks out smiling, walks out much better, that's my joy. Just like the faith goes, that God does the healing and we give the service, or we give the service. We are vessels and God does the healing. So I believe God is at the background of every service that we give as nurses. I want to acknowledge that there are very many nurses outside there who also have a lot of passion for their profession. But probably they haven't yet gotten the opportunity to give the service. We have a group of nurses who finished their training way back last year, the certificate, the diploma, and there are nurses who also finished internship program for bachelors, but they haven't managed to get a license of practice to date because of issues around the nursing council. I really would appeal that if possible, there would be a very urgent need for this matter to be resolved, because these are very innocent souls suffering outside there. They want to work, but everywhere they make their application, they do not have the practicing license, which the nursing council is supposed to give. And for this reason, they are not given the job. And so we shall keep crying that we don't have enough nurses to give the services, especially at this time of COVID-19. We need nurses more than any other thing. Whoever is handling issues to do with the nursing council, I really appeal that that issue be handled. I don't know how, but I really feel for those colleagues of ours outside there who want to give the service and they are denied opportunity because the practicing license is not there. It is not their fault that they don't have it. Some of them registered, they have receipts, but they don't have the practice license. And most organizations that you apply, they want the practice license with your certificate of practice. Without that, you are denied. Please, this matter, I feel, should be urgently handled.
Maybe before we go ahead, do we know how many people are affected by this?
Well, I can't tell the population of those that are affected, but I've met quite a number of nurses, those who finished certificates, those who finished diploma, those who finished internship last year, and for one reason or the other, their license is not there because the nursing council, there are issues around the nursing council, not satisfied.
What are the issues?
I can't tell the details of issues within the nursing council. I don't want to go into the details, but